This is an educational video, one that is described as scenario 2. These are events that are possibilities to happen and how we in the United States perceive these threats and effectively deal with them. The Federal Emergency Management Agency, or also known as FEMA, this scenario is as I would be the director of FEMA. I have become aware of an event that has occurred on December the 15th that has involved the release of a vaccine that has become mutated by September. Symptoms that are associated with this vaccine infections are signs that would resemble the flu. The symptoms are vomiting, diarrhea, fever, and headaches. There have been a report of 256,907 cases that have spread over several states between 3 to 5 days. 3 to 5 days of the initial symptoms. In response to this increasing threat, there will be national communications between local, state, federal, and public and private entities nationwide. I am considering this national threat as Category A. It's a statewide emergency. We can address this threat and effectively deal with it. As the FEMA director, I will monitor the health issues and pinpoint specific causal factors that are associated with the maladaptive vaccine. I will select communications such as the Food and Drug Administration and entities that are responsible for supervising the public health and monitoring programs in order to assess the prevalence and incidence rates of the infections, thereby tracking the spread of this health condition. I will appoint the National Incident Management Systems. This entity will also monitor the progress of the mutated vaccine effect. This organization is designed to guide all emergency personnel effectively. This organization is efficient in collaborating within other crucial entities, such as the United States Homeland Security. The Department of Homeland Security is at our disposal. This entity coordinates and displays medical teams throughout various locations. They're also in conjunction with the pharmaceutical stockpile, which is under the guidelines of the Department of Homeland Security. One of its functions are to implement medications and drug supplies for use during an emergency event, along with the Metropolitan Medical Response System, which has a direct involvement with emergency chemical weaponry. They also are in conjunction with the National Institute of Health. This organization will be useful for countermeasures of the mutated vaccine. This entity's primary role is to prevent, diagnose, and to treat conditions that are caused by medications. It also operates under the Federal Drug Administration, or the FDA. Through our collective efforts, we will address this and eradicate this national health threats. This issue has we currently have shipments of untainted vaccines throughout the nation. These injections will be dispersed for every American that is in need. The mutated virus has created a health risk throughout our United States, affecting every man, woman, and child. The mutated vaccine has created havoc statewide. However, we will eradicate and effectively provide and produce countermeasures to eradicate this mutated vaccine. Under the guidelines of the Centers for Disease Control, information will be announced to the public. The Centers for Disease Control provides education concerning the risk and the spread of the infection, as well as collaborating with the Office of Public Health Preparedness and Response Organization. The Office of Public Health Preparedness and Response Organization role, along with other entities, is to oversee and observe and report. Its focus is on geographical locations within the highest incidence rates that is observed. Another organization that is useful in this fight would be the OPHR, along with the CDC, will determine the type of characteristics of the mutated vaccines that are responsible for the contagion. The organization will collectively detect, modifiable irregularities associated with the mutated vaccine, while reporting hospitalizations that have linked the vaccination effects. This entity's role will also address the proper medication that is available to the public. We will and can analyze this mutated vaccine, its effects, and provide countermeasures that will effectively eradicate this disease. All the public should be aware that there are non-mutated vaccines that are available, and they are provided within all health organizations. You can find these within your hospitals, clinics, and other healthcare organizations. We will have safe, health, peace, and prosper. Thank you. My name is Leslie Austin. Oh. Okay, baby. Now I need to stop it. I pushed the record button, right? And it stopped?
Yes.
Seems like it's still going, though, Precious. Look.